African Americans are 3 times more likely to die or become very sick from COVID-19, but they are getting vaccinated far less than whites. As WCPO 9 News reporter Larry Seward explains, advocates' response is very much in your face.
Welcome, everyone.
Almost every other week since Thanksgiving.
How do we know which one is for us?
Virtual town hall meetings.
We talk about the real deal here.
Get real close.
My stepmother passed away from COVID.
To a gap in healthcare.
Studies show that African Americans are dying due to COVID-19 at a higher rate than any other race.
We're a group that makes up a quarter of Hamilton County's population got no more than 10% of available coronavirus vaccine.
I am terrified of the vaccine.
If you get the COVID vaccine, you got to get the flu shot too.
That's 2 different diseases.
So you'll basically, to stay safe, you have to be safe, get both of them.
Yes.
You see, the thing is that our generation is comparing the flu coronavirus as if it's the same thing. Like, I've survived the flu without getting the vaccine, so I can survive COVID without getting the vaccine. And I think that is...
It attacks different organs. In fact, COVID attacks just about every organ system we know. That's one thing. And it does it to folks who are not at high risk.
What is your greatest concern?
We have lost many lives, and people don't have all the information they need to make the best informed decision.
Renee Mahaffey-Harris runs Cincinnati's Center for Closing the Health Gap, the group behind the town halls.
We must save us.
They've launched ad campaigns, even paid people to join focus groups to better understand resistance to COVID-19 vaccine. One recent NAACP study found that just 14% of African Americans, less than other minority groups, trust that COVID-19 vaccines are safe. Reasons include the U.S. government's 1932 Tuskegee experiment that recruited, misled, and never treated hundreds of black men for disease. Because of it, Dr. Odell Owens, a member of Ohio's Minority Vaccine Task Force, says mistrust of healthcare and research remain. But
on one hand, we're pushing for African Americans to be first in line, and people are saying, oh, I don't want to be a guinea pig, I'm going to sit back. Well, now you're at the back of the line, and there's a shortage of the vaccine.
And I did get the Moderna vaccine.
Harris's group has no plans to stop or slow down. They're convinced information is key to closing the vaccine gap.
Supply is key here, too. Without more vaccine, experts told us it's hard to narrow disparities. Kristen?